Good morning, everyone. My name is Cheryl Koehn. I'm the founder and president of Arthritis Consumer Experts, one of the arthritis consumer patient groups and organizations that are working together here at this year's annual meeting for the Canadian Rheumatology Association and the Arthritis Health Professions Association. We're really excited to kick off our morning with Leslie Soever, who is the president of the Arthritis Health Professions Association. We couldn't be happier that she's with us here today. We have a full lineup of interviews today, so we hope that you stay with us throughout the day. You'll follow along on Twitter as well. You can certainly ask questions of Leslie as we move through our interview, and we will fire them at her, and she will do her level best to answer them. And if we don't have answers, we will get back to you. How is that? So welcome, Leslie. It's really a privilege to have you here with us this morning. I guess we want to start with you, a logical place, and we'd like you to tell us a little bit about who you are, what your background is, your role as president, and a little bit about the Arthritis Health Professions Association. I'm not sure that our Facebook fans and viewers actually know sort of the nitty-gritty about what it is you do as a national organization.
Okay, well, thank you, Linda, and Cheryl, and it's my pleasure to be here this morning representing the Arthritis Health Professions Association. And yes, just very briefly a little bit about myself. I am a physiotherapist by background and have been involved in healthcare in various capacities for more than 30 years as a clinician for the most part. I've also worked in research related to arthritis and have led some management and leadership roles, which I guess as my career has progressed have been important because I've been able to transition some things that I think are very important for patients with arthritis.
And you have this huge clinical experience, and when you take that up to a higher organizational level, you're able to disseminate that, I imagine.
Absolutely,
yeah.
Absolutely. And so it's my privilege, too, to be the president of the Arthritis Health Professions Association, and we are a very dynamic group of individuals. We are Canada-wide, a national organization that represents a multitude of professions who have interests in arthritis care for patients with arthritis.
So name some of those, Leslie.
So some of those are occupational therapists, nurses, physiotherapists, social worker, pharmacists, dietitian.
Oh, wow. We
have research personnel who are interested in research related to arthritis, people who do coordinating activities for,
So that's a huge scope just in practice alone, let alone activity on the part of the association.
Yes.
That's amazing.
Yeah.
How many members do you have?
We have approximately 115 members.
Okay.
It varies year to year. We also encourage students to be members. We have some student members.
Yeah. Do you find as a membership, is that enough?
Well,
or are we looking for more?
Well, we're always looking for more.
Yeah.
And sometimes one thinks that larger numbers have larger voices, but we do also feel that with a relatively small number of individuals, we do have a fairly significant voice. But of course, we're always looking for more members because we know there are more individuals across the country who are definitely dealing and delivering care, doing research, other activities related to arthritis, where we would benefit from their membership, and we think our organization would help them to do their work.
Yeah, I think it's, if you can have ground troops, so to speak, across the country, especially in arthritis, where, in terms of physiotherapy or occupational therapy, it's often difficult to get access to those things.
Yes.
Or we, as people living with arthritis, have to pay out of pocket for them in many provinces, or if your private insurance has a limited number of visits. And then when we get to those people, Leslie, sometimes, you walk in and you say, well, I have, ankylosing spondylitis, or I have rheumatoid arthritis. If that specialist, if that health profession doesn't have arthritis training, sometimes they look at you with a bit of a blank stare. So I imagine your association plays a very important role in educating people without arthritis specialty training. Is that a correct assumption?
Yes. So I would say our organization has three main objectives.
Yeah.
One is education. So
Yeah.
we really try to promote arthritis-specific education to our members. The other one is we try to promote research amongst our members so they're involved in research related to arthritis. And the third is advocacy. And advocacy I'm using very generally as advocacy for our members in instances like you described, where there aren't a lot of publicly funded services. And so we have a voice in those issues.
So you would go to government and say, hey, we have a significant shortage here, and we need to address the gap.
I mean, we would like to do that. I
Yeah.
can't honestly say we have done that yet, but I certainly see that as a need and something that we would be interested in engaging in.
Yeah, we've done a lot of things in the organization I lead with the Canadian Rheumatology Association, for example, and their members. And I think those are some of the partnerships, perhaps, that we need to grow.
Absolutely.
In order to better represent on our side of the equation, on the patient side, and going to government with you and saying, you know what, we don't have enough of Leslie's in our community, how do we get more of you? I think that's a really important outcome, perhaps, even from this meeting where you've integrated patients. Thank you again, into the wonderful pre-course program you held yesterday. Can you tell us a little bit about what you did yesterday?
Yeah, I would love to tell you about that, because that is very exciting for us. We have in the past, and you have come and spoke at our pre-course in past years, but I'm somewhat embarrassed to say we haven't included patients and invited them to be part of the audience.
Yeah.
And we realized that we need to do that, and that's very important. And having the patient voice in the discussions after the presentations, and a lot of the presentations were very interactive, and really having the patient's voice and learning from patients in the moment in real time was very, very exciting for me yesterday to experience, and I think everyone learned. And I always say, you know, I think we have as much, if not more, to learn from our patients than we can give them in education. So
I don't know. I wouldn't sell yourself short, because I have to say, as a person living with rheumatoid arthritis myself for almost 30 years now, my interactions with all of the professions that you represent, I spend more time with those people than I spend with my rheumatologist. So those interactions, even from the very beginning of my disease journey, Leslie, were really important to me. That the nurse who provided me my injection back in the day when we didn't do it ourselves, every week I would go in, and she would, you know, tell me about something she'd read in the research. She was phenomenal. And I think that's the kind of partnership we enjoy with the members of your association. And I guess that's why I'm super keen to hear about, if not growing your membership, then infiltrating the ground troops who actually see people like me, to deliver services and education even to us in a more sort of direct way to our specific disease states.
Yes.
What for you, so pretend you're not the president for a second, what for you as a member of your own association did you learn yesterday? What were one or two pearls you walked out with?
Well, I would say one of the pearls, one of our keynote speakers was Dr. Proton Raymond.
Oh, yeah.
And he has a vast wealth of knowledge. And his talk, and I'm very much generalizing, but was really looking at the future of healthcare and genetics and epigenetics and some of the things that maybe we can, you know, interrupt some of these inflammatory diseases before they actually happen. And it was just very exciting to think about the potential that we all may have as we move forward. I think there have been great gains made, but you know, when we listened to him, it was very exciting. So that was one thing. We had a very interactive presentation at the tail end of our day from a psychologist. And this is where maybe, you know, I feel that we have lots of tips to learn on just, it's not what we have to give to our patients, but how we deliver our messages and when we deliver it and how we time it and how we listen. And I think listening is so key. And there's a perception that saying nothing and listening takes a long time. And, you know, if you take 5 minutes to listen, sometimes the amount of time that can save you in your clinical encounters, because we are time limited in the amount of time we have to spend with our patients, we can reap back those minutes multi-fold.
Yeah, I would agree with you. We were involved in an international project called the RA Narrative, and it looked at the interaction between the rheumatologist through a survey. So they surveyed rheumatologists and surveyed patients, and then we compared the responses. And where rheumatologists felt they were talking about patients' goals in a treatment, setting a treatment plan, patients didn't perceive them to have heard those things. To your point, probably more listening needs to take place, an opening for patients perhaps to share a bit more freely, and the rheumatologists need to understand that that will be time-saving, if not immediately, then certainly at subsequent visits.
Absolutely.
Because the patient will sort of get on board, feel more empowered and in charge of what it is they're going to be doing with their healthcare team, and actually sticking with the plan. So we were super excited to see some of those results, and then to be able to build a program out on it called Joint Health Education. So, and this first one specific to rheumatoid arthritis. I wonder if you could sort of look forward. So put your crystal ball in front of you and say, what's going to happen in 2017, 2018, 2019? Given we don't have a cure yet, although Dr. Rahman, I know, was very exciting in his talk yesterday, we're still a fair bit away from actually turning the disease off for good, unless we take meds. So not a medication-induced remission, but a true cure. So while we're waiting for that, that's where I think your association members play such a critical role in our lives. So what do you see for yourself as an advanced practice therapist, and your association? Like, sort of just peer into the future if you could.
Maybe I'll speak, and I haven't really mentioned this.
Yeah.
I am an ACPAC trained physiotherapist.
Right.
And ACPAC stands for Advanced Clinician Practitioner in Arthritis Care. And that program is open to physiotherapists, occupational therapists, and nurses currently, but certainly I know the directors of the program are certainly broadening the horizons of that program. And basically, it's a competency-based program.
Yeah.
And it allows those of us who have graduated from the program to practice with extended scope. So, for example, ordering some investigations, doing some preliminary interpretation of those investigations. And I think the most important thing it allows us to do, it allows us to triage patients. And my experience... What do you mean triage?
Just explain that for our viewers.
Okay.
Yeah.
So what that means is, and in the arthritis world, many patients wait a long time before they're diagnosed. And then once they're diagnosed, they may wait a long time to get
And
treatment.
waiting is bad.
And waiting is bad.
Yeah.
Because it can negatively affect the ultimate outcome of the disease.
Right.
So, and there are long wait lists to see rheumatologists, and there are relatively few rheumatologists across the country.
Right.
So with this advanced training, patients with symptoms that may be suggestive of inflammatory arthritis or other types of arthritis can come to an ACPAC-trained clinician, and that diagnosis and the road to being diagnosed can be done at a much earlier stage.
I love this. I like what your crystal ball is showing us.
Yes.
Yeah.
And so there are some very successful models across across the country, but I know I'm more familiar with the ones in Ontario. And I think it's been an uphill struggle, but I think we are on the cusp of those models becoming more acceptable.
Yeah.
There are, and I'm someone who's just very honest, there are some issues with funding those models. And so we have to look at creative ways of funding these models, but my crystal ball, and this is where I'm going to speak from both a clinician and an AHPA, an Arthritis Health Professions Association perspective, that I'm really optimistic that we're going to see more of these models become available to patients with arthritis, and patients with arthritis will have earlier access to diagnosis and treatment that includes a team that is more interprofessional.
Right.
I think we've been talking about it for a long time.
And now you're starting to do it.
I'm hoping that it's going to happen.
Well, I can tell you, Leslie, that our viewers out there in Facebook land will be thrilled to see that happen, to see what's in the crystal ball actually play out, in our communities. There's 5 million Canadians who live with one of over 100 different types of arthritis, and a number of those types, in fact the vast majority, are autoimmune types of disease. And unlike, for example, a disease like mine, I don't have a tumor with my autoimmune disease. I have inflammation. So inflammation is my tumor. And the longer we wait to deal with my inflammation, oh, we're live. That's the announcement for the next session. We actually people don't understand that. And if we can talk that way to people, governments who do fund what's inside your crystal ball, I think we stand a better chance of actually working together to make it a reality. There's no way that, 350, 400 practicing rheumatologists can treat 5 million Canadians. Last night we had some really good advice from a government relations expert, Michelle McLean from Hill & Knowlton Strategies. And she told us, send in your stories, tell them to government, and that story includes how the arthritis health professions are important to us. It's not just a rheumatologist, it's our advanced practice or trained physiotherapist, occupational therapist, and also support psycho-emotionally, psychosocially. That, I think, is one of the biggest gaps out in our community. We don't really have someone trained to talk to about the things, besides medicines, besides our painful bodies, to talk about the pain that lives inside of us when we receive a chronic, lifelong diagnosis. And I think kudos to you for pulling all of these wonderful professionals together to help people like myself and millions of others in Canada. We're so blessed. I'm going to look to our moderator and see if we have any questions for Leslie. Okay, so we have no questions at this time, but we know they'll be coming, and we'll be hounding you with answers or for answers.
Yes.
So we want to thank Leslie very much. We remind you that at 10 o'clock, is it 10 o'clock, Anita?
Yep.
10 o'clock is our next interview. We may be on the air with a surprise guest before then, but we want to thank you again, Leslie. We wish you the best of luck in pulling what's in that crystal ball out and making it a reality. Couldn't be happier to have spoken to you this morning.
Well, thank you very much for inviting me, and yes, I look forward to collaborating further with many patient organizations, including ACE, to make the crystal ball happen.
Fantastic. Here's to the crystal ball.